Stroke isn't treated just by the emergency staff in the hospital, it's treated by specialised teams. As you possibly know, strokes can be caused by a bleed or a clot, and the treatments for each are different, and so they need to establish what's going on inside your head, which requires having a CAT scan. I think it took 10 minutes for the ambulance to arrive and 10 minutes to get to hospital. But the advantage of calling an ambulance is that from the point that the ambulance team arrived, they've diagnosed what's wrong and they've let the hospital know what's coming in. My stroke was caused by a clot, and the treatment is a clot busting treatment called thrombolysis. So it's a medication that's given intravenously, and it dissolves blood clots, is what it's aimed to do. I was in a high observation unit in a hospital, so constant nursing supervision in a room of 5 people. Every 15 minutes they take your blood pressure and check for responsiveness in your paralysed limbs. They get the end of a biro and jam it under your cuticles to see if you flinch, and if they're doing it to you every 15 minutes, the answer was no, I didn't flinch. I had total paralysis in my limbs.
When someone has a stroke, it's very important that they have a brain scan within the first 24 hours after a stroke. And the brain scan helps doctors actually diagnose a stroke because it gives the medical team a picture of the brain. CTs and MRIs are brain scans that can give the medical team more information about the stroke. There's also a number of tests to work out what sort of things might have contributed to the cause of the stroke. So someone might undergo blood tests, scans, and also heart tests. A very common test that all stroke survivors should have early on is called an ECG. It's also called an electrocardiogram, and that test looks at whether or not there might be abnormal heart rhythms or the presence of heart disease. Another common test that stroke survivors might undergo quite early on is called a carotid Doppler, and that test looks at whether or not there's any blockage in the carotid arteries which run through the neck.
They did all these tests and they were doing scans, and they ended up giving me a spinal tap looking for fluid on the brain and things like that that would indicate it was a tumour. And it wasn't until they did an MRI that they saw my brain and that there was unusual shading on my brain that was on the right side of my brain, which would be indicative of a stroke on the left side of your body, which was the area that was affected.
So thrombolysis is a procedure where a clot-busting drug is administered. So it's a treatment to minimise the damage that might be caused by a stroke. It doesn't actually reverse the damage of a stroke once the damage is done. So in certain types of strokes where a blood clot is blocking a blood vessel to the brain, a clot-busting drug called RTPA can be used to thin the blood and break down the blockage in the blood vessel, and that allows blood to flow again to the brain.
During my stay in the ICU, they had found that the brain fluid in my brain was going beyond its limit, so they had to perform life-threatening surgery on me and take out part of my skull to drain the fluid. And that's why I've got this scar here. You can't see it. It's what they call a craniotomy. And then so when I got to the acute stroke ward, I was wearing a helmet to protect the skull because it's almost like a balloon. There was nothing there. I could squeeze here and it was all soft. First of all, the nurses were pretty cautious dealing with me. Wearing the helmet was annoying. I had to wear it when I showered. I wore it pretty much most of the day, walking. And then later on, when I got transferred to the rehab unit, they needed to perform another surgery on me. And this was the cranioplasty. And that's basically where they get the bone from the bone bank and they put it back in and they stitch it up.